Officials characterized Los Angeles County's new mask mandate, requiring even vaccinated people to cover their faces indoors while in public, as a minimally disruptive, common-sense tactic to blunt rapidly rising coronavirus transmission. But the fundamental question remains: does it make sense? After all, the latest health order, set to go into effect Saturday night, is at odds with guidance at the state and federal levels that fully vaccinated people need not wear masks because of the shot's extraordinary effectiveness, while adding that local authorities are free to adopt a more stringent stance. But LA County isn't alone. Its posture is consistent with that of the World Health Organization, as well as the Israeli government. And more entities are following suit. 7 counties in the San Francisco Bay Area on Friday recommended that everyone wear masks in indoor public areas. The counties that signed on the recommendation were San Francisco, Santa Clara, Alameda, Contra Costa, San Mateo, Sonoma and Marin. They joined Sacramento and Yolo counties that made a similar recommendation earlier in the week. And UC San Francisco on Thursday implemented a campus-wide indoor mask mandate. County officials say there's a real need to take action now. Though infections and serious COVID-19 illness are still only a fraction of what was seen over the fall and winter, daily coronavirus cases are now 6 times what they were on June 15, when California fully reopened, and COVID-19 hospitalizations have doubled since then. But the recent trends nonetheless represent a meaningful increase in the spread of the disease in the nation's most populous county. Here are some key takeaways. The U.S. Centers for Disease Control and Prevention has a 4-tier framework for assessing community transmission, with categories ranging from low and moderate to substantial and high. According to a Times analysis of L County's daily case rate, the last time regional transmission would have been considered substantial or high was in March. By June, L County recorded its lowest daily case rate, calculated as an average over a 7-day period, since the early weeks of the pandemic, at just 11 weekly cases for every 100,000 residents. By contrast, during its worst moments of the pandemic, L County was recording more than 1,000 weekly cases for every 100,000 residents. But this week, L County crossed back into the substantial category, and as of Wednesday night, was recording 75 weekly coronavirus cases for every 100,000 residents. The CDC defines high community transmission as 100 or more weekly cases for every 100,000 residents. In an op-ed published in The Washington Post in April, 3 experts suggested that restrictions can lift once COVID-19 hospitalizations fall below 5 hospitalizations for every 100,000 residents.